Welcome back to our YouTube channel.
Now we'll see PNF facial exercise. Okay, PNF facial exercise. These exercises are very nice exercise for PNF patients. Patient can do himself. I mean, patient can do herself when they were doing exercise. Okay, these exercises we have to do in front of mirror. Okay, patient should be having mirror here. Okay, by seeing mirror, she has to do exercise. Okay, now we'll see just few exercises. Okay. So PNF exercise, we know what is PNF exercise. So here what we have to do, suppose now you imagine left side is affected, that is pulse, okay, right side is normal. Whenever we are doing exercise, unaffected side, we will give resistance to the movement what patient is doing, unaffected side. Affected side will give assistance to the movement what patient is doing, that is first one, okay. Second one, before giving this PNF exercise, we can apply ice therapy, like a small ice cube, we can apply. What is the use of this thing? It is going to increase the tone of that muscle, tone of that facial, that side facing, and sensitivity also. That one. And one more side, one more point, we have to do this PNF exercise always bilateral. We have to do this PNF exercise. Okay. Now we will see how to perform this exercise. First muscle क्या हुआ? Frontalis. First we will see for frontalis. Now for our patient, this side is affected, this side is affected, this side is unaffected. So whenever we are performing the exercise, therapist has to apply either resistance or assistance in diagonal pattern. In diagonal, PNF will discuss the D1 flexion, D1 extension. D means diagonal. So here this side is affected, left is affected, right is unaffected. So now we are doing exercise for frontalis muscle. We have to keep our fingers diagonal pattern. So here see, this side is unaffected. Here only we have to ask patient to just raise your eyebrows. That's it. Okay. One more time. Do. Okay. See, one more time. Now what we are going to do as a PNF, when patient is performing that movement, we will give resistance to the unaffected side and assistance to the affected side. Nandini, do now. Right. Again, do it. Again, do it. So this is for frontalis muscle. Clear? This is first. One more way we can do for this frontalis muscle. See here, therapist has to little bend her neck. Okay, therapist has to bend her neck. Usually, when we are performing, therapist has to touch her head with his chest. But here no need, we can do like this also. Like this we are going to keep our fingers same place. We will ask patient to just lift up and raise your eyebrows. Lift up and raise your eyebrows. When she is doing that movement, that time also same. Unaffected side will give resistance, affected side will give assistance. Do nothing. Right. One more time. One more time. That's it. Okay. Okay. Now we'll see corrugator muscle. So for corrugator muscle, we have to do this movement. Okay. This movement patient has to do. So this is unaffected side. Here I am going to give a resistance to the movement. Here I will give assistance to the movement. Do Nandini. Right. 1, do it. 2, do it. 3. Orbicularis, oculi. Okay. So here we will have superior and inferior. We have to give exercise for both superior and inferior. So now we are going to give as resistance to the unaffected side and assistance to the affected side. We will ask patient to close eyes. We will ask patient to close. One more time. Wait one more. That's so. This is the activity. Unaffected side resistance, affected side assistance. Now inferior also same we are going to do. See here we will give little resistance. Here we have to give assistance. Close your eyes. Close. That's it. This is the activity. So while performing these activities, we need mirror so that patient can see easily how he is performing. Next one. Unaffected side. This is affected side. Here I am giving resistance to that movement. Here I have to give assistance to it. 1, 2. One Zygomaticus muscle means Zygomaticus muscle. Here we just ask patient to smile. That one. Okay. So here doing exercise is fine. Okay. This side we give a resistance to the smile. Mean here we give assistance. You just have to do like You know green color. Say green. That. Here will give resistance. Here will give assistance. Do. Right. One more time. Two. Do once. This is the function. So this activity patient has to do for Orbicularis oris muscle. So this is unaffected. Here I am giving resistance. This is affected. Here I am giving assistance. Do once. 1, 2, 3. Exercise patient has to show her upper teeth. Now here this is unaffected side. I will give resistance. I will give resistance for the upper movement of the lip. Here I will give assistance. So 1 with 2 with 3 right. Buccinator muscle. So here patient has to see. Here we have Buccinator is a main mastication muscle. Here patient has to do this movement. So open mouth.